The fluorescent lights hummed overhead, casting their merciless white glow across the ICU of Seattle General, where Megan O'Brien stood at the bedside of Colonel James Hartfield, her eyes tracking the cardiac monitor with the precision of someone who had learned long ago that machines tell the truth when people lie. The ventilator wheezed its mechanical rhythm beside him, a sound she knew as well as her own heartbeat, and her fingers moved across the monitoring cables with the quiet competence of someone invisible to the hospital hierarchy, the kind of nurse that residents never remembered and attending physicians never learned the name of. Her scrubs were exactly like everyone else's, faded teal from 100 washings, and the unit patch sewn inside her jacket lining, the only physical proof she had ever worn a different uniform, pressed against her skin like a secret that could not be spoken. Colonel Hartfield had arrived in the ER 4 days ago, his chest splitting open in the back of an ambulance, his heart betraying him with the kind of sudden violence that didn't care about rank or service record. The emergency thoracotomy had been clean, a surgeon's work, technically flawless, but the real resuscitation had happened in those chaotic minutes before, when the monitor flatlined and the room filled with that particular electricity that comes when death walks in and someone has to walk back out. Megan had been the one to initiate chest compressions, her hands finding their rhythm on his sternum, counting compressions the way she had counted them 1,000 times before in places where the walls shook from distant mortars and the only light came from emergency lanterns hanging from tent poles. 27 minutes. Her hands knowing exactly when to push, how deep, when to pause for medications that she was not technically supposed to administer but did anyway because the alternative was watching a man die when she knew how to prevent it. Now, 72 hours post-op, Hartfield was stable. His ejection fraction was climbing. The surgical team's notes were clean. He was going to live, and the only person in Seattle General who understood the true price of that survival was the quiet woman checking his for drips at 6:17 in the morning when the ward was still mostly dark. She did not see Dr. Pierce coming. The attending appeared in the ICU bay's doorway like weather moving in, sudden and inevitable, flanked by 15 residents in their pristine white coats, their stethoscopes draped around their necks like expensive scarves. Pierce was tall, silver-haired, the kind of man whose voice seemed to occupy more space than his body did, and he moved through the ward with the assured gait of someone who had never been told no by anyone who had the power to make it stick. His tailored charcoal suit cost more than Megan's monthly rent. His shoes were Italian leather, polished to a shine that reflected the ceiling lights. He did not look at her until he wanted to, and when he did, it was the way a surgeon looks at an X-ray, something to be read, interpreted, and then forgotten. "This," Pierce announced, his voice pitched for the residents, his hand gesturing broadly at Megan's documentation, "is what happens when nursing exceeds appropriate scope. When someone cannot accept the natural conclusion of a patient's journey and instead imposes their own judgment over established medical protocol." Megan continued her work. Her hands did not pause. She adjusted the flow rate on the secondary line, her movements precise and economical, the kind of efficiency that came from years of knowing exactly what her body needed to do before her mind had finished consciously deciding it. 27 minutes of unnecessary chest compressions, Pierce continued, holding up her handwritten notes like evidence of a crime. 27 minutes. On a 72-year-old patient with a documented DNR. Do you understand what that means, residents? Do you understand the liability exposure here? One of the younger residents shifted his weight, uncomfortable with the public spectacle, but the others watched with the hunger of medical students learning hierarchy, learning which behaviors were rewarded and which were punished in the ecosystem of American medicine. They were learning that power was not about knowing more, it was about being able to describe what others did in the worst possible terms while everyone listened without interrupting. The patient code was apparently, Pierce paused, his inflection making the word into an accusation, misplaced. The original DNR was unavailable. And so our enthusiastic colleague here decided that her interpretation of the clinical picture trumped documentation. Decided that 72 minutes of aggressive resuscitation. 27 minutes, Megan said quietly, without looking up from the monitor. Her voice was soft, almost apologetic. The composure style they had taught her, years ago, in a different uniform, in a place where showing anger got people killed. Pierce's head turned. His eyes focused on her as if she had materialized from the wall. The compressions, she continued, still adjusting equipment, were 27 minutes. The total resuscitation was 42 minutes. "Thank you for that clarification," Pierce said, and his tone suggested he was not thanking her at all. 42 minutes, then. Of heroic intervention. Of exceeding scope. Of creating exactly the kind of liability that this hospital cannot afford. Megan's jaw tightened, but only infinitesimally. Her hands moved on to check the arterial line, reading the waveform on the monitor the way other people read books, the subtle movements, the pressure variations, the rhythm that told you everything about what was happening inside a closed chest. Colonel Hartfield's BP was 118/76. His heart rate steady at 67. His O2 saturation 98% on 40% FiO2. The man was alive because she had remembered her training. Because in those moments when his heart had stopped, she had not accepted that it should stay stopped. The residents filed past, most of them unable to meet her eyes, the way people react to public humiliation, with the embarrassed silence of witnesses to something that feels unjust but that no one has the social courage to contradict. One of them, a woman with dark hair and a surgical pin from Northwestern Medical School, looked directly at Megan for just a moment, and in that moment, something moved across her face, not sympathy, but recognition. The look of someone seeing another person be diminished and recognizing it as a lie. Pierce moved on, his entourage following, their white coats snapping against their legs as they walked. The bay fell silent except for the monitor's steady beeping, the ventilator's hiss, the ambient hum of machines keeping people alive while other machines decided which people were worth saving. Megan did not move until she was certain Pierce was far enough away. Then, very slowly, she pressed her hand against the inside of her jacket, feeling the unit patch sewn there, faded now, threadbare, the edges curling, and she let herself breathe the way she had learned to breathe, years ago, when breathing was a deliberate act and not something the body did automatically. In through the nose. Hold for 4 counts. Out through the mouth. The trembling was not fear. It was restraint. It was the discipline of someone who understood that the worst response to humiliation is to show it has landed. She pulled up Hartfield's chart on the computer terminal and began entering her notes from the morning rounds. Vital signs stable. Cardiac output improving. Mental status alert and oriented to person, place, time, and circumstance. No signs of post-resuscitation syndrome. The patient should be extubated by tomorrow if this trajectory held. What Megan did not know yet was that Colonel Hartfield was awake. What she did not know was that he had heard every word Pierce said, heard it clearly through the sedation fog and the machinery, and that he recognized her voice, not from Seattle General, not from this moment, but from somewhere else entirely. Somewhere that officially did not exist anymore. Somewhere that his own military records indicated he had never been. The machines beeped their steady rhythm. The morning light began to creep across the Seattle skyline beyond the ICU windows, touching the sound with the pale glow of 6:33 a.m., and somewhere in that quiet room, a man in an ICU bed with fresh surgical staples holding his chest together closed his eyes and tried to remember the face that went with that voice, that woman who had saved his life twice, once in a field hospital in Tikrit 7 years ago, and once again here, now, when a cardiologist with expensive shoes had wanted him to die. Quietly instead. But that was not the worst part. The worst part was that Dr. Pierce had already made 3 phone calls from his office before the morning light hit the windows at all, and the machinery of his solution, carefully constructed, precisely timed, executed with the competence of a man who had been improving his art of human destruction for almost a decade, had already begun to move. At the nurse's station, the shift had turned toward the hour when exhaustion made cruelty easier. 2 residents, Castellano and Morrison, stood near the supply cart, their shoulders angled toward each other in that specific posture of shared mockery. Pierce had drifted over, coffee in hand, watching with the satisfaction of someone who had just created an audience. Castellano pitched his voice high and uncertain. "But doctor, I really think we should try." He pressed one hand to his chest, eyes wide with performative concern. Morrison made an exaggerated crying face, reaching toward the tissue dispenser mounted above the desk like he was drowning, gasping for air he didn't need. The other nurses at the station didn't laugh. They didn't stop typing either. They simply became very focused on their computer screens, their silence a form of consent. Pierce watched the performance like a conductor observing musicians execute his composition. His expression held something between approval and hunger, the look of a man watching the machinery of his power work exactly as designed. One more push. That was all it would take. Megan O'Brien stood 6 feet away, reviewing the lab values on Hartfield's chart. Her hands were steady. Her breathing was steady. Everything about her posture suggested she was unaware of the performance, though of course she had heard every word. The residents knew this. That was the point. This wasn't about whether she heard. This was about whether she would break. Pierce moved closer, his shadow falling across the computer screen. Ms. O'Brien, a word. It wasn't a request. It was a command delivered like a surgical instrument, precise, impossible to refuse without consequences. She set the chart down and turned to face him. The movement was controlled, deliberate. One measured breath. She had survived worse than this. That wasn't the thought that went through her mind, it was deeper than thought, embedded in muscle memory and bone, in the knowledge that soldiers learned in tents where the walls shook and the stakes were measured in minutes instead of career trajectory. Security is getting concerned about your stability, Pierce said. His voice carried a texture of false sympathy, the kind that made the lie more effective. The way you lost control in that bay yesterday, the emotional outburst, the refusal to accept clinical boundaries. That's not safe behavior, for you or for our patients. I think it would be best if they escorted you out. For your own protection. The tissue dispenser's motor hummed somewhere in the background. The ventilator from ICU Bay 3 produced its mechanical wheeze down the corridor, a sound like breathing through wet cloth. Megan held his gaze. One measured breath. And then, in a voice that could have been pulled from stone, she said exactly what he had not anticipated, the words delivered with such quiet precision that every person at the nurse's station stopped breathing. Colonel Hartfield is alive because I remembered my training, and that's something you'll have to live with. The silence lasted exactly 3 seconds. Then Pierce's face shifted, not toward anger, but toward something colder. Determination. He turned and walked back toward his office, his jaw tight, his shoulders carrying the tension of a man who had just been reminded that direct assault wasn't working. From his office, the phones began to ring. For calls. The first to Chief Medical Officer David Chen took 6 minutes. Pierce's voice was measured, clinical, presenting Megan's actions in terms of institutional liability, a nurse performing duties outside her scope, making unilateral medical decisions, causing documented trauma to residents through her unprofessional demeanor. He had documentation. He could provide it. The pattern needed addressing before another patient was endangered. The second call went to risk management at 2:13 a.m. Pierce walked his supervisor through the math, extended resuscitation efforts on a coded DNR patient, potential legal exposure, the cost of liability insurance for such incidents, the necessity of swift disciplinary action to protect the hospital's coverage. The voice on the other end was eager to help. Risk management was always eager when you framed things correctly. The third call, placed to the State Nursing Board at 2:22 a.m., was handled by an answering service, but Pierce left a message dense with procedure violations and patient endangerment concerns. The machinery was moving now, slow, institutional, inevitable. By the time Megan understood what was happening, the paperwork would already be in motion. The final call went to his contact at the hospital's largest insurance provider, a man named Rothschild who owed Pierce favors from a resuscitation 3 years back that Pierce had handled in a way that reduced the payout by $400,000. I have a liability problem, Pierce explained. Nurse performing unauthorized interventions, documented mental health crisis, potential for escalation. I'm moving to terminate, but I need documentation that supports an aggressive separation. The employee is unstable. Rothschild didn't ask questions. Rothschild had 5 figures worth of reasons not to ask questions. By 2:38 a.m., for institutional gears had begun their rotation. The machinery of bureaucracy, once set in motion, moved with the indifference of a grinding stone. Megan didn't know yet. She was still in the ICU, checking Hartfield's vitals, ensuring that the man her son served under, the man who carried the weight of decisions that affected her child's life, remained stable through another night. She had no idea what was about to happen. But Pierce did. And that was the difference between someone who understood power and someone who simply responded to it. The resident mockery. The threat of security. The implication that she was unstable, unfit, a liability. These were just the opening moves. The real assault was already in motion: paperwork, phone calls, institutional allies mobilizing to remove her from the system before she could notice what Dr. Pierce had been doing. Before she could see the patterns in his code calls, the missing documentation, the subtle alterations to patient records that converted quiet deaths into extensive resuscitation efforts. She had saved Hartfield. And in doing so, she had made herself dangerous. Not because she was a threat to Pierce, but because she was a witness. A witness who knew how to think under pressure, how to see what others missed, how to act when others froze. And that was something Pierce could not allow to continue breathing. The monitor alarm shrieked at 2:38 a.m. 3 sharp beeps, then silence. Then the flat line that made every nerve-ending scream. Megan was at Hartfield's bedside before the second beep finished. She'd been sitting 3 floors down in the break room, coffee cold against her palms, staring at nothing. Something had pulled her up. Something always did. The ICU called to people like her the way gravity called to falling things. His eyes were open. Unfocused. The kind of open that meant the heart had already decided to stop asking permission. "Code Blue, Bay 7, she said into the ceiling. Her voice stayed level. Professional. The voice of someone who'd seen organs fail before breakfast. "I need a crash cart. Now." The night shift was skeleton crew. 2 nurses covering 6 critical beds. That was the first thing she noticed, the absence of bodies. The second was the empty chair where the on-call surgeon should have been sitting, laptop open, ready to run up 3 flights of stairs the moment his pager sang. She ran through the mental math: 2:38 a.m. on a Friday. Night supervisor was charting at the desk. 1 resident somewhere in the building, if she was lucky. The attending had been rescheduled to some conference in Portland. She'd seen the calendar change yesterday when she wasn't supposed to be looking. 3 minutes. That's how long the brain could sit in the dark. Hartfield's chest heaved once. Stopped. The monitor showed the electrical pattern of a man whose heart had filed for divorce from his body. She started compressions. Palms locked, arms straight, the kind of compressions that cracked ribs if you did them right, the kind that kept blood moving when everything else had given up. 1, 2, 3. 1, 2, 3. The rhythm that lived in muscle memory before the brain caught up. "Where's the crash cart?" Not a question. Coming. Nurse Rodriguez rounded the corner, rolling the metal defibrillator through. Young. Scared. "I called for the surgeon. He's in Portland." Rodriguez's face went white. "Get me a scalpel. 14-gauge needle. Open tray. Move." Still not a request. The voice had changed without her permission. Dropped an octave. Lost the pleas that had been living in her throat for the last 72 hours. "And get me 1 milligram epi. For push. 1, 2, 3. Compressions." The chest under her palms was a rigid thing, a thing that had been working 20 minutes ago. Hartfield's face had that waxy look, the look of a man whose oxygen had packed its bags and left town. The monitor showed asystole. Dead rhythm. The electrical flat line of a heart that had stopped bothering to lie. Rodriguez pressed the needle into the fall line. The epinephrine went in like a prayer nobody believed in anymore. O2 monitor read 58. The numbers climbing down instead of up. The scalpel was warm in her hand. Someone had left it on the tray, blade catching the fluorescent light above the bed. She didn't think about where her hands were going. Thinking was the enemy right now. Thinking was what got people killed. The skin gave way. Fifth intercostal space, midclavicular line. The anatomy was the same whether you were in Savannah or Tikrit, whether the light was LED or the kind that came from helmet lamps held by people whose hands were shaking. The anatomy didn't care about paperwork or jurisdiction or whether someone had authorized you to be here. Blood spilled across her fingers. She was moving now, the thoracotomy opening like a mouth, the ribs spreading under her gloved hands. The pleural cavity opened. Air hissed. That sound, she'd almost forgotten that sound. That exact hiss of air escaping, the sound of the body's architecture coming into view. There. The pulmonary artery. A bleeder that should have been clamped in surgery. A mistake that meant Pierce's team had closed him up with blood still bleeding into the chest cavity, pooling, pressing, suffocating. She clamped. The satin sky clamp from the tray bit down on the bleeder and the bleeding stopped. Just like that. Just like in that sandstorm-darkened tent in Tikrit where the electricity had gone out and the mortar rounds had been shaking the walls and she'd held a young Marine's heart in her hands and willed it to keep beating. Oral airway. She didn't raise her voice. Command didn't need volume. Command was the absence of doubt. 100 milligrams succinylcholine for RSI. Rodriguez moved like she'd been struck. Terrified. Competent. The good kind of scared, the kind that made people pay attention. Her hands massaged Hartfield's heart. Gentle. Insistent. The way you talk to something that had forgotten how to live. Come on, Colonel. Stay with me. Fingers around that muscle, feeling for the flutter that meant something was still home. O2 monitor, 62. 68, the numbers climbing now. Climbing toward human instead of away from it. 72. 78. Her fingers still moving, still talking to that stubborn muscle in that man's chest, the muscle that had pumped blood through his body while he led the 332nd Air Expeditionary Wing and saved 19 pilots and never once asked why his son's old unit kept calling. 85. 90. Sinus rhythm appeared on the monitor like a star breaking through clouds. First one beat. Then another. Then a rhythm that looked almost like a song. The chest expanded. Hartfield's lungs remembered how to breathe. His pupils, which had been blown wide, started to shrink back down. She stepped back. Just slightly. Hand steady. Heart rate exactly where it had been before, which was never. The kind of calm that came from understanding that panic killed faster than any blade ever could. Get me surgical closure. 2-0 suture. Then, quieter, someone call the attending in Portland. Tell him the patient is stable. Tell him he might want to rethink his schedule. Rodriguez was staring at her hands. At the blood. At the way Megan was already moving for the surgical closure, every motion precise, economical, the kind of movements that didn't come from YouTube videos or nursing school textbooks. How did you, Rodriguez started? Muscle memory. The words came out flat. Empty. The truth that wasn't the whole truth, the way most truths weren't. You do something enough times, your hands remember how even when your brain wants to forget. That's when Rodriguez's eyes went to the jacket Megan had thrown across the back of the chair. The white coat she wore over her scrubs, the one that had been hanging in her locker since she'd started here 8 weeks ago. The inside lining was showing. The faded unit patch, sewn in careful stitches by someone who'd learned to sew before she learned to walk straight. The patch worn soft by time and carried in places that patches didn't usually go. Air Force, 332nd Air Expeditionary Wing. Rodriguez's mouth opened. Closed. Opened again. But that wasn't the worst part. The worst part was that Hartfield, still half sedated, still half alive, turned his head on the pillow and looked directly at those stitches. And his eyes, cleared of the fog, cleared of the near-death, cleared of everything except recognition, found hers. And in that moment, with his chest open and his heart restarted and the monitor singing that beautiful mechanical song of someone who was supposed to be gone but wasn't, Colonel James Hartfield smiled. Like a man who'd just figured out why his son's unit had called him every single week for the last 8 years asking if he'd heard anything at all, from the pilot they called Valkyrie 6. Pierce's hands moved like a surgeon who already had the outcome planned. He made the first call at 1422, Chief Medical Officer picking up on the second ring. "We have a patient endangerment situation." Captain O'Brien, he paused, letting the military title slip like an accusation, performed an unauthorized thoracotomy at bedside. Open chest surgery without attending supervision. The liability exposure is catastrophic. His voice carried the tone of a man protecting an institution when really he was protecting himself. The chief medical officer's response came muffled through the receiver, but Pierce nodded like she'd agreed with everything he hadn't quite said yet. He hung up and dialed again. Risk management answered faster. This time his language shifted, more technical, more damning. Unilateral surgical decision. No protocol followed. Patient could have died from post-operative infection or improper wound management. We're looking at a 6-figure settlement minimum. He listened to objections he'd anticipated, then countered with numbers: $347,000 in estimated exposure, plus the cost of defending against a potential lawsuit if the family decided to pursue it. By the time he hung up, the decision was already made. The State Nursing Board call came at 14:53. Pierce had their emergency contact memorized. "I need to report a scope violation. A registered nurse performed surgical intervention without physician authorization. It's documented in the chart. Patient's family may pursue criminal negligence charges." The board representative asked clarifying questions. Pierce answered each one with the precision of a man who'd rehearsed this exact conversation in his head 100 times. He wasn't angry anymore, anger was sloppy. This was execution. The final call went to his contact at Pacific Northwest Health Insurance, a man named Sterling who owed him favors from 3 malpractice cases Pierce had helped him win through selective expert testimony. "Sterling, we have a situation at Seattle General. One of our nurses just created massive exposure. I'm trying to contain it before it reaches your desk, but you should know what's coming." He described the thoracotomy. He described Megan. He described the liability as if it were a wildfire spreading through their policyholders' records. Sterling listened, and when Pierce finished, Sterling said exactly what Pierce needed to hear: "We'll flag her file. If there's any other incidents, we'll recommend immediate termination. Protects everyone." By 1622, the termination letter was typed, printed, and waiting on Megan's locker at the end of her shift. Seattle General used standard termination language: professional, measured, lethal. Patient endangerment resulting from performance of unauthorized surgical procedures. Violation of nursing scope of practice. Failure to follow chain of command protocols. Effective immediately. The words were surgical themselves, each one designed to cut without leaving blood. There was no appeal process mentioned. No suggestion of review. Just a simple statement at the bottom: your hospital identification and credentials are to be surrendered before you leave the building. Megan found it at 1641, still in her scrubs, still wearing the adrenaline of Hartfield's arrest like a second skin. She read it once. She read it again. Then she folded it carefully, the same way she folded everything, and walked to the hospital laundry room without speaking to anyone. The room smelled like bleach and hot cotton, fluorescent lights humming overhead in that particular way that made time feel elastic. She stood at the folding table and began removing her scrubs from the hamper, 3 sets, all the ones she'd worn since Hartfield arrived. The fabric was still damp in places where sweat had soaked through during compressions. She folded the first set methodically. Sleeves tucked in. Bottom folded. Crease sharp enough to cut. Her hands moved with the muscle memory of someone who'd packed field gear in sandstorms, who'd learned that precision in small things kept you alive in large ones. The second set followed the same pattern. Third set. Each fold was deliberate. Each crease was perfect. This was what remained when everything else was stripped away: the ability to make something orderly from chaos, to impose control on the uncontrollable, to turn even a termination into something dignified. She reached the inside of her jacket lining, where the faded unit patch had lived for 7 years. The 332nd Air Expeditionary Wing, Tikrit-based, the threads frayed at the edges from being handled too many times. The patch that proved she'd worn a uniform. That proved she'd been someone other than a nurse. That proved all of this, the humiliation, the termination, the whole careful construction of her invisibility, was something she'd survived before. The patch felt like sandpaper against her fingertips. The rain had started outside. She could hear it against the single high window of the laundry room, steady, cold, the kind of rain that felt personal. Seattle rain. The kind that made you understand why people moved away. She stood there in the humid air of the laundry room, holding a patch that no one at Seattle General knew existed, holding proof of a life that officially didn't exist anymore, and for the first time since Pierce had started his campaign against her, something inside her trembled. Not her hands. Not her voice. Just something deeper, something that lived in the space between who she'd been and who she was pretending to be. She could throw the patch away. She could drop it in the industrial trash bin next to the dryers and walk out of here clean. No evidence. No history. No proof. She could disappear again, this time into the domestic lives that normal people built, the ones without classified operations or Pentagon scrubbing or orders to vanish. She held the patch over the trash for 11 seconds. Her arm was steady. Her breathing was level. But her eyes burned. Soldiers don't cry, but soldiers also know that some things are worth holding on to even when holding on costs everything. She tucked the patch back into the lining. Creased her jacket with the same precision she'd used on her scrubs. Folded everything else into a small cardboard box that had held surgical gloves. Hospital ID. Credentials. The termination letter. The only things they were letting her take were the ones that didn't matter. Everything that mattered was what she was hiding. The laundry room door was steel gray. The window above it showed parking lot and rain and the kind of evening light that comes at 17:09 in late autumn. She was about to leave when she heard it, distant, almost unreal, a sound that didn't belong in Seattle. Rotors. The mechanical pulse of a helicopter cutting through rain and wind, getting closer. She stopped. The sound grew louder. Closer. It was impossible. It was here. She turned back to the single high window and looked up, but the angle was wrong. She could only hear it. Growing. Closer. The kind of sound that changed everything. The rotor wash hit the windows of Seattle General like hammer blows. The helicopter was minutes out, maybe less. Megan heard it through the laundry room door she'd been about to close forever, that particular base frequency that meant military transport, the kind that doesn't land on civilian hospital helipads without authorization from people whose names didn't appear in phone directories. She didn't move. Just stood there holding her folded scrubs, rain still dripping from her jacket collar onto the tile. The intercom crackled. Not a routine page. Command voice. All personnel clear the main entrance. Incoming VIP transport. Security protocols in effect. That was when the ER doors exploded open. The Iraqi translator, Hassan, she recognized him now, was wheeled through on a stretcher with acute appendicitis. Surgical abdomen, rigid as concrete, breathing shallow. The resident covering trauma that morning was ordering labs and typing and crossing blood. Standard protocol. Except Hassan's eyes found Megan the moment she stepped back into the corridor, and he started weeping before he could even speak. Valkyrie 6, he whispered. His voice cracked on the second word. My God. Valkyrie 6. You're alive. The room went still. Not quiet. Still. The kind of still where you feel the oxygen leave. Megan kept moving toward him, her stride exactly the same as it had been 5 minutes ago, the same as it would be 5 minutes from now. One breath. Even. Hello, Hassan. You need emergency surgery. You don't understand, he was saying, tears streaming down his face. After the mortars. When you held them. For hours you held them alone while we got out, and they told us you didn't exist. They said you were never there. That none of it. Surgery, Megan said. Flat. Calm. The resident was staring at her like she'd suddenly developed a second head. Now. Get him prepped for emergent appendectomy. Level 1 trauma protocols. Move. Colonel Hartfield appeared at the nurse's station, still in his hospital gown despite explicit orders to stay in bed. His surgical incision was barely 48 hours closed. He was holding something. A citation. His hands weren't shaking, but his eyes were bright with something that looked like rage and relief combined. Dr. Pierce was 3 steps behind him, already shouting about medical liability and AMA paperwork. Everyone stop, Hartfield said. Not loud. Command voice, the kind that doesn't require volume. He pulled the document open with his one free hand, his other arm strapped tight against his chest, and started reading. Captain Megan O'Brien, for extraordinary heroism under fire in Tikrit, when hostile forces overran the combat hospital, you held the surgical suite for 4 hours alone, facilitating the evacuation of wounded personnel, maintaining medical operations under sustained attack, and refusing extraction orders until every patient who could be moved had been transported to safety. The ward had gone absolutely silent. Pierce's face had started turning colors. Red first, then something darker. He was opening his mouth to speak when the elevator doors opened. A 2-star general stepped out in dress blues. Not walking. Moving the way only senior military move, with a weight of command in every step. His eyes found Hartfield's military decorations first, rendered a salute that could have cut glass, and then turned to Megan. Captain O'Brien, he said. His voice was a tank idling in a garage, power beneath absolute control. The Pentagon has been looking for Valkyrie 6 for 7 years. Megan felt something inside her settle. Like a piece of her spine she didn't know was fractured had just aligned back into place. Pierce made a noise. A strangled sound like air escaping from a crushed lung. He tried to step forward and the general simply moved, a lateral shift that put his body between the doctor and everyone else, not aggressive, just immovable. Like a wall that had learned to breathe. Dr. Pierce, the general said, still not looking at him. You're done here. The next 3 minutes happened with the precision of a military operation. 2 FBI agents emerged from the stairwell, badges already displayed, and they moved straight past Hartfield and Hassan and every nurse in that corridor. One of them was holding a tablet. The other was reading from a warrant. Dr. James Pierce, we have documentation of alterations to patient codes dating back 18 months, the first agent said. Systematic billing fraud associated with resuscitation efforts on deceased patients, falsified documentation of DNR status, and most recently, attempted forgery of personnel records related to a protected federal witness. Pierce's hand started shaking. Actually shaking. Megan watched his fingers flex and curl like they belonged to someone else. She recognized that motion. It was the tremor of someone's body rejecting what his mind was experiencing. The same tremor she'd seen in surgeons' hands when something they'd done went wrong and they didn't know how to fix it. That's not, she wasn't supposed to, Pierce's voice had gone thin. Hi. She performed an unauthorized surgical procedure. She violated her scope of practice. She was insubordinate and emotionally unstable, and I was protecting this institution. By altering her personnel file retroactively, the second agent said. By attempting to forge disciplinary documentation. By initiating contact with hospital legal counsel to construct a narrative that would hold up in court. All of which was logged in real time by Homeland Security because Captain O'Brien's status as a protected federal asset triggered a monitoring protocol the moment you attempted to access her records without authorization. The handcuffs were standard issue. Stainless steel. They caught the fluorescent light as the agent applied them with the kind of efficiency that came from practice. Pierce's breath was coming in short gasps now, his eyes moving between the agents and Megan and Hartfield like he was trying to calculate an escape route that didn't exist. This is a mistake, he was saying. This is completely, I have representation. I have lawyers. This hospital will. But the hospital wasn't going anywhere for him. The entire staff had lined the corridor. 30 people. Maybe 40. Nurses and residents and aides and respiratory therapists, all standing in absolute silence, watching Pierce get walked past them with his hands in restraints behind his back. His face had gone the color of old bone. One nurse met his eyes as he passed. Just held his gaze. Didn't say anything. Didn't have to. Megan watched him go without moving. Her hands were at her sides, perfectly still. Her breathing was even. The trembling wasn't fear. It was restraint. The kind of restraint that comes from understanding exactly what you're capable of and choosing not to. The general turned to her. Rendered another salute, this time not to Hartfield's decorations, but to her. Direct. Deliberate. Your status is restored, Captain, he said. Effective immediately. We have orders cutting you to active duty with the Air Force Medical Command. You're going to assume command of critical care training at Lackland. The program is understaffed and it needs someone who knows what it means to operate under pressure. Hassan was being wheeled toward surgery. The resident was jogging alongside the stretcher now, actually running to keep up, suddenly aware that he was in the presence of someone he'd completely misjudged. The appendectomy would take 40 minutes. Straightforward. Hassan would recover. He'd live. Megan was quiet for a long moment. I'll need clearance to finish my shift, she said finally. Her voice had dropped an octave. Command voice. The voice of someone who'd already made the decisions that mattered. Colonel Hartfield needs post-operative monitoring for at least another 6 hours. Hassan needs to wake up from anesthesia with someone who understands what has actually survived. And this ward needs continuity of care while you process the facility violations. The general's mouth might have been a smile. Captain, you were terminated less than 2 hours ago. And now I'm not, Megan said. I have 14 hours before I need to be on transport to Texas. Patients don't care about paperwork. The paperwork happened anyway. It always does. But it happened around her, not because of her. Megan spent those 14 hours exactly where she belonged, moving between Hartfield's recovery and Hassan's post-operative care, her hands checking vitals and adjusting medications and holding the things she'd never been allowed to hold in the open before: authority, recognition, the particular gravity that comes with knowing exactly who you are. 6 months later, Megan drove past a strip mall in Tucson on her way to Lackland's Officers Club. The medical supply van was parked outside a discount urgent care. The name on the storefront, Quick Clinic. Walk-ins welcome. Dr. Pierce was loading boxes into the back. No, not boxes. Bandages. Antiseptic. Supplies. His name tag on his shirt read, Steve. Single letter, no credentials. His face had aged. The kind of aging that comes from understanding that every choice you made was yours and nobody else's to blame. He flinched when someone called him doctor in passing. Actual flinching. Like the word had teeth. Megan kept driving. Her Air Force dress blues hung in the passenger seat, pressed and perfect, ready for the ceremony at Lackland where she'd officially take command of critical care training. 317 medical personnel would be under her supervision. Young people. Mostly scared. All capable of being better than they thought they were if someone who understood pressure showed them how. Hassan had sent flowers to her apartment in Savannah. Orchids. White ones. The card had been simple: thank you for coming back. We knew you would. But he was wrong about that. She hadn't come back to the field. She'd come forward. To a place where the O's you keep don't require you to disappear. Where the people you save actually get to know your name. Hartfield had requested assignment to Lackland's liaison office. He wanted to work with her. It wasn't romantic, he was 3 years married with twin daughters, but it was something like family. The kind of family you build from people who understand that heroism doesn't happen in the light. It happens in the moments when nobody's watching, when the choice to help costs you everything, and you do it anyway because that's who you decided to be a long time ago in a place that officially doesn't exist. True heroism is what you do when the world stops watching. When Megan started her first morning in the Lackland Critical Care Unit, there was a young nurse waiting by the equipment station. Nervous. New. The kind of person who was pretty sure she'd never be good enough. Megan didn't tell her who she was. Didn't need to. She just picked up a chart and said, "Come on. I'll show you how we do this." The trembling wasn't fear. It was the weight of becoming the person someone else needed you to be. If you love a good underdog story, hit that like button now. Subscribe so you never miss one. And comment below, have you ever been the underdog? Let's see how this plays out.